I'm asking what should be done about assaults, violence towards NHS staff who are trying to help patients who then turn on them. Should those patients be denied NHS free care? Are there any circumstances where that kind of violence is understandable, forgivable? Let's speak to Karen, the Labour Councillor in Thanet District Council. Thanks for joining us on the show, Karen.
You're welcome, Lembit. You're welcome.
You sit on the, I think the Kent Medway Health Overview Scrutiny Committee at the council.
Yes, that's right.
So you have had pretty much first-hand experience of the policy making on this. What's your view about this?
I think a zero-tolerance approach in our NHS, in our hospitals, is long overdue, actually. I was quite shocked to read the extent of the attacks, the verbal abuse, the physical attacks against NHS staff. And so I think it's a sort of long overdue, much needed measure. I think it's a bit of a disgrace that we've got NHS staff that feel that they need some sort of protection by wearing body cameras. That's not really what people go to work for. And of course, as employers, the trusts do have to take seriously the environment in which our NHS staff work. And they are responsible in a way for making sure that if violence against them, verbal and physical, can be avoided, it should be avoided. But I think what's worrying, what's coming out of this report, is the fact that some of the larger unions, Unison, Royal College of Nursing and the Health Consultants Association, are saying that the environment now is creating a tinderbox, and that's really worrying.
The issues have been clearly expressed also by Matt Hancock, the Secretary of State for Health, here on BBC Radio Kent, in fact. And yet we've got the impression from those on the inside that it's an issue that's getting worse. Why is it getting worse, in your opinion?
Well, what the research from the trade unions is showing is that it's a crush inside the NHS, the pressures, the demand on the staff to provide resources to patients, which is creating this hothouse effect. So you can imagine if you're in an A&E waiting area and the waiting times are bossed and you're there for hours and hours and hours, and they're far from comfortable places, as I'm sure you're aware, that is going to increase people's likelihood to lose their tempers. Equally, having patients on trolleys in corridors is another sort of pinch point. So there are situations inside our hospitals that we could avoid that I think would lessen the tensions that people experience. And there's never any excuse for physical and verbal aggression. I mean, I would never condone it at all. But a part of me can understand if you're there with somebody that is in agony, that you could get frustrated and that could manifest itself in, let's say, being very sharp. And that's really deeply unpleasant for staff to be on the receiving end of.
This is when it gets complicated, Karen. I mentioned earlier that I went to see a friend who had a sudden heart issue. He had an ongoing heart complaint and he was suddenly rushed into hospital on a Friday night. So I went in there, it must have been about 11:30 at night, and the A&E waiting room was like a war zone. There were loads of drunk people or high people, I'm not sure which it was. They were lolling around. There was abuse going on between the patients. They were shouting at the staff. How do you tell those individuals who are frustrated because they're concerned about their loved ones from those who have just rolled in off the street, having fallen over because they had far too much to drink? And should they be treated differently?
I don't think they should be treated differently, and I'll tell you why. I think there are some medical health conditions that can leave you in a strange state. So you could be diabetic and you could go into quite a strange state. And actually, if you were sitting waiting in an A&E and people didn't realise that you had a particular condition, you might seem agitated, aggressive, etc. But that might not be anything at all to do with your character, with drinking, with drug taking. I mean, I think sometimes the police presence in our A&Es, if we had police officers or support officers that could just stroll in. And it's one of the things that really worries me, that we don't have sufficient police presence.
I wanted to explore a couple of difficult cases here. You said before that you didn't think it was feasible to deny health provision to individuals, even if they become violent. But what about repeat offenders? They get drunk every weekend, and they know that they're going to get drunk. That's their plan. They go out to look for a fight and take their violence into the hospital. To what extent should the NHS repeatedly tolerate that?
Well, they could have the police on speed dial, couldn't they, in an ideal world? If they've got a repeat offender that rolls up regularly late at night and really drunk and offensive, they ought to have the police on speed dial. But I think with regard to this latest initiative from the government, one of the things they've challenged the CQC, the Care Quality Commission, to do is to ascertain the data. So I appreciate what you're saying, but I would want to know how many, if we call them frequent flyers, we've actually got in the system. Because I'm guessing that most people that go to A&E or end up in a situation like this actually aren't those people, that there are many people that are going into the NHS system and becoming really frustrated. And that's certainly what the health workers are saying themselves, and that's certainly what the major trade unions are coming out and saying. It's too much pressure in the system, people waiting too long for treatment. That's causing aggravation, and that's spinning over into verbal and sometimes, very sadly, physical hostility towards staff. Completely ridiculous. You can't condone it. I don't think the solution is to stop treating people.
If we do treat everybody, then the NHS staff will inevitably find themselves in a position where the same individuals do come in. You call them frequent flyers, those who fly into a rage, fly off the handle, and then get stretchered into hospital. Is it really a good use of taxpayers' money to repeatedly patch up individuals who are then causing assault and battery problems for the staff?
No, we could probably do something with those individuals out in the community if we know that they've got problems. So let's imagine that they're going through the court system and they get some sort of sentence, and that includes a relationship with the probation service, and the probation service can then help them with anger management, etc. So there are things that can be done. Of course, it does slightly depend on funding this out in the community. But I think the people that go in on a regular basis are not the problem here. As I say, I think this is much more widespread than that. I mean, this report says that over 10,000 cases of reported incidents of violence towards staff in the NHS. And the report also says that most of the NHS staff now are frightened of being attacked. So this is a bit more widespread than people rocking up at the A&E in a dreadful state. And I think also we do have people that have profound mental health issues that turn up at A&E because there really isn't sufficient care for them elsewhere. And we do occasionally have people, and I'm not a clinician, so I can't really give you chapter and verse on this, but we do have people that turn up in A&E that appear to be agitated and aggressive, but actually that's a manifestation of their actual illness. So you would be putting staff in a really difficult position if you were asking them to ascertain which was a drunk that didn't deserve or didn't warrant treatment and which was a person that actually was having another sort of health issue going on. So we've got to be a bit careful there, I think, not to overburden NHS staff, but to protect them.
Thanks very much indeed for joining us. That's Karen Constantine, Labour councillor on Thanet District Council, and she sits on the Kent and Medway Health Overview Scrutiny Committee, saying that you can't put staff in a position to have to differentiate between the deserving patients and the undeserving ones based on violence, because it's not feasible to make that kind of assessment during that hospital visit.